Yes.
Okay.
I mean.
That's all you have?
Well, no, I could probably ramble on. I mean, I could talk about hospitals shutting down. I could talk about the economy of the state going into total turmoil. I could talk about a whole mess of things. But yeah, the answer to it is yes. I'm one of the ones that voted for it. Recognizing that there was really no other alternatives put forward. I mean, that's the other side of it. And Prop 204. You just saw the other day where the ruling came down on the education side. There would have been a court case that would have forced the state to bring back the population that I wasn't in the legislature at that time, but that they had to take off the rolls. This is a decision that was made by the taxpayers many years ago, and we just basically had to stick with it. I mean, I've got a constitutional obligation. I can't say this or this, but I mean, when you raise your right hand, it's it's an awesome experience, and somebody here will get there. You raise your right hand, you defend the Constitution of the United States and the Constitution of the state of Arizona, and that means that the voters have told us several times that we had to fund access, and that's what it's all about. I mean, when they call it a whole mess of other things, it's what it is, and it would have cost the state billions of dollars. Because we were told by the feds that they would have dismantled access along the way if we basically didn't do a few things, because it's a pilot project. It's one of the best run systems in the country. It's basically private. It's based on a privatized type model, which everybody would want. And I know it's bothered a few people, but understand that it's the right thing to do for the state. It's an economically right thing to do for the state, and it was what the voters have directed us as state legislators to do.
There was really no winner in that decision. Someone was going to be affected, whatever the decision was going to be. It's unfortunate that it had to be arrived at in the method that it was. There are other states that have chose a different path to take, and there are a lot of things that I don't know about it that weren't shared with all of us. We only know what we know, and it may or may not be enough. So sometimes the term is you don't know what you don't know. And in this case, there's a lot of things that I don't know about that, but I think that we probably could have looked at other alternatives, and I think that the communication to the state could have been a heck of a lot better.
Like John, I would have liked to see another proposal and the alternate proposals put forward. When you look at the whole health care, I think people need to understand that there's health care and there's health insurance. And health care is where you go when people are sick. Health insurance is for things that are random, unplanned, and catastrophic. Similar to car insurance, you have catastrophic car insurance. So I think plans like that, where people can choose the insurance plans that are best for them. Health savings accounts is also a good example. They can choose best savings plans or insurance plans for themselves. Maybe at a young age, if they're strong and healthy, they'll choose one plan. As they age, their plan is going to morph into something that's more amenable to their life and their lifestyle. I think we need to kind of separate the two and work towards that end. The hospitals sometimes have their hands tied. I don't know if you're familiar with medical residencies, but they are paid for by the federal government. If hospitals want to give residents raises, they have to get an approval by the federal government. If there's a new technology that they want to introduce into their hospital or a new division, to get medical residents, it has to be approved by the federal government. I think peeling away some of those things also is going to give the hospitals more flexibility and more opportunity for free market concepts.
I think it was the only rational decision that they could have made. Basically, you had the federal government coming in and saying, you can insure 4 people for $100, or you can insure 3 people for $150. Which one do you want? 4 for $100 or 3 for $150? That's a pretty easy choice. It's a slam dunk. I think the legislature made the right choice. That has brought $1.6 billion of federal money into Arizona. If you break that down and just consider our district, for our district, our share is about $1,000 per family per year, that your insurance rates would have gone up by that much more without the access or Medicaid or whatever it is you want to call it. The people that don't have any coverage, when they get sick, they don't just go back in the alley and die quietly. They go to the emergency room. That's the most expensive care that we can get. And the hospitals, they're not the federal government, they can't print money, so what do? They have to give the care, they're bound by law and by ethics to do so. So they have to pass it on to the insurance companies. And the insurance companies can't print money like the government can, so they pass it on to guess who? Us, the insured people that pay rates. So our rates go up to cover that. With the access or Medicaid, those people can now go to an urgent care center, which is a lot cheaper care, and they get the appropriate care that they need. So it's just better for everyone around. And I've heard some people say, well, it's evil to take federal money. But if we don't take the federal money, they'll just give it to California or New York or somewhere else. I would rather have it come to Arizona, since they're going to throw it away one way or another, throw it toward us and help the families in our state.
I guess it was a misunderstanding as I'm sitting here, because I think people think that Obamacare is what we just did at the legislature, and it's not. And that's what you just talked about. And it has nothing to do with the private side. This had to do with the public side, and had to do with taking care of the indigent people that are out there. That's the access side of it. It has nothing to do with the private sector aspect of medicine. I mean, I don't support Obamacare or whatever you want to call it. I never have, never will.
And none of us do here.
But on the side of dealing with what the state and what we're dealing with indigent people, we had to do that. And as David said, it's $1.6 billion into the state economy. But it's also just getting recent reports. It's actually it's what we did actually works in this state. And you look at the uncompensated care costs that are happening in hospitals. Chandler Regional Hospital, or I still call it Chandler Regional Hospital. It's dignity healthcare.
That is so.
It goes back to my days of getting the hospital built and serving on that committee. But it's I'll call it Chandler Regional for the purposes of this situation. They now were able to afford and have a level 1 trauma facility. What that's done for our constituents is enormous. The wait in case you're in an accident, your life is in danger. To be able to have a trauma 1 facility in your community is huge. And their uncompensated care rate, I think, is now down to about 6 or 8%. And that's enormous as well. So they were having people come through the door at these enormous costs, and they just weren't able to take care of it because they were mandated by law to take care of them. And now they're able to take care of them. I've had doctors, and I've asked them while down at the legislature, let me know some of the successes, because you want to know some of the things you've done if you've been successful. People that treat diabetics are much happier, because the people that were getting with the uncompensated care, they can now come into the practice and be treated, as opposed to the emergency room, as David just stated a minute ago. That's saving us hundreds of thousands of dollars, possibly into the millions of dollars on a statewide basis. So in reality, what we did was we met the 204 population. They're back. They were able to get into the system, and they were able to get the care, which have kept the state's costs down as well as the overall cost. It's not Obamacare. I'm not in Congress. I didn't vote for Obamacare.
And there was a report in the newspaper just this weekend about the hospitals, and Bob alluded to it, that their unreimbursed care was down something like $70 million this quarter.
That's
the first
investment in the
quarter.
community.
And that's because of the access or the Medicaid, because now those people are not going to the emergency room and getting unreimbursed care that we, the insured people, end up paying for with our premiums. So it's a success story. It's working, and I'm glad that it is.
You know, I think we really have to understand that the common person out on the street doesn't know a lot of what you know. The hospitals were in serious trouble. There's no question. Did we need to do something? Absolutely. Did we do the right thing? Time's going to tell about that. But I think the more important thing is that the communication process wasn't good. The process that was used was scary. It scared a lot of people. The thing about Obamacare is that it's a federal government investment in health care in Arizona. The obvious connection is there. And if we had better communication coming out of the state, the Capitol, I think it would have made some difference to people. But with all the things that happened there, and that's why I said the key issue was the process. And if that had been handled a bit differently and backed up a little bit differently, I don't know what the response would have been.